Welcome to Behavioral Health in the New Normal, a podcast developed by Prestige Community Resources, aimed at bringing healing back to our community through knowledge, expert advice, and positive messaging. The show is a joint venture between the Department of Behavioral Health and Prestige Community Resources, funded by SAMHSA in response to the challenges currently impacting our communities. Hosted by Paul Wells Sr., who uses over 30 years of extensive clinical social work experience to conduct insightful interviews with experts and professionals on a wide range of topics that impact the Washington, D.C. community. From behavioral health crisis to education to financial hardship and anything in between. This show will provide information and insights that will surely make a difference in your life.
I would like to welcome everyone back to the Prestige podcast series, Behavioral Health in the New Norm. I am so excited today because I'm going to get a chance to have a discussion with my dear friend and colleague, Mr. Will Bonnette. Bonnette and I go back many, many years. In fact, as I was preparing for this segment, I counted about 26 years ago, I first met Mr. Bonnette. And at that time, we were both running very large outpatient substance use disorder programs, the two largest in the city. We had multiple locations. I think Mr. Bonnette actually was running one out of Maryland as well. And I was so impressed with his knowledge and commitment to recovery. We were both actually working with mandated clients at the time. And I think it was a contract with Federal U.S. Probation Office, DC, that we were really focused on and in partnership on. So today we're going to get a chance to talk with Mr. Bonnette, and I'm going to really introduce you to him. The focus today is really going to be on Narcan. And for those who don't know what Narcan is, Mr. Bonnette is going to describe that. We're going to learn today how it works, how it's administered, and how it helps those who are in recovery or those in the recovery community. Mr. Bonnette's been doing this work 25 plus years. He has 25 years of operational leadership experiences. He possesses a master's or MBA with an emphasis in healthcare systems improvement and a master's degree in project management. Mr. Bonnette currently leads the Prestige nonprofit organization, Prestige Community Resources, or PCR. PCR is dedicated to improving the lives and healthcare outcomes of the homeless and residents of underserved communities in Washington, D.C. Mr. Bonnette, how are you, sir?
Man, I'm blessed and highly favored. Paul,
Indeed.
I'm not going to claim nothing else.
That's right.
We're all blessed. Some of us know it and some of us don't.
That's right, right.
Yeah.
And I'm very aware you know it, and I definitely know it. So, Ms. Bonnette, let's start with just kind of your background. Where were you born? Where were you raised? What were your early life experiences? Could you share that with us, please?
Absolutely. I'm a native Washingtonian. I love D.C. And, D.C. people, you know them wherever you go.
That's right.
They just have a certain swag about them. I was born in the district. My dad was a sharecropper from South Carolina who served 25 years in the military, World War II and Korean War. My mom is from Indonesia. Okay. And she, as an immigrant, came and, met my dad. I've got two brothers, so there was three of us. I was the youngest.
Yes.
And just growing up in DC, being exposed to everything that's DC.
That's right.
I love it.
And what's some of that? I think of go-go music, mumbo sauce.
The Tivoli Theater, the Savoy Theater, the Atlas Theater.
Come on,
like
keep
the
going.
Lincoln, like Petworth Band. DC is such a vibrant community. When I grew up, the Blackbirds were recording the Blackbirds, they're a band from our neighborhood. And
that's right.
The district communities changed. I remember every neighborhood used to have a band, and now every neighborhood has a rapper. So it kind of changes how, in the mindset of the young people in our community and how they grow and what their value systems are.
What part of DC did you grow up? What section of DC?
I grew up in Petworth, Shepherd Street, 13th and Shepherd.
13th and Shepherd, okay.
Yeah, I'm the Uptown crew.
Uptown,
That's
okay.
what's
I
up.
should have known that just by the way you walk. You know, the Uptown brothers have now you mentioned DC swag, and that is so true. But the Uptown brothers, I mean, they have their own little vibe about them.
Don't get it twisted. I got a passport, so basically I can go in almost any segment of the city and be all right with people because I've helped a lot of people.
This is true.
And we all face the same struggle. It doesn't matter whether you're uptown, downtown, east side, west side. The struggle's different, but the struggle is the struggle.
Absolutely.
And you know, we have to embody unity.
That's right.
And compassion.
Absolutely.
And how we deal with each other.
You know, you are respected in the metropolitan DC area, and you have the privilege of going in any ward, any side of the city based on just who you are as a person, but also the remarkable commitment and contributions you made to those who are in the struggle, who are just struggling to survive and maintain good mental health, maintain solid recovery. And so you have full access to the community. So you grew up in DC, you went to DC public schools, and you had a full rounded DC experience. How did you decide, and why did you decide to go into mental health and substance abuse services?
You know, when I look back on my upbringing, one, you know, my name is Wilhelm, so I felt like I didn't fit in. And not fitting in was a big issue for me.
Yeah.
And what I discovered is when I smoked weed, when I had drugs, then I could fit in.
Okay.
Everybody wanted to be my friend. And don't get it twisted, I wasn't a dumb guy. You know, I went to a public school, you know, and around the 9th grade, one of my English teachers reached out to me and she said, "You're wasting your time." I said, "What are you talking about?" She said, "You're in school, but you're not being challenged. You're getting straight A's, A's and B's in what you do, but this is like a playground for you." And, you know, she arranged for an interview at Gonzaga, which is a prep school in the district.
Right.
And I ended up in Gonzaga on scholarship. There was a priest there. His name was Father Horace B. McKenna. And I worked in the rectory, and Father McKenna single-handedly planted seeds of hope in a lot of different communities. He's one of the people that helped to found So Others Might Eat, Martha's Table, McKenna's Wagon. All of that was all about the philanthropic work that he did in helping people who couldn't help themselves. So I think the seed was planted there then.
Okay.
And as a high school student, I was writing meal tickets and mission tickets so people could sleep in the gospel mission. I was interacting with people, and I realized that poverty, drug abuse, hard times don't have no conscience.
No.
Anybody can get it, you know, and these are human beings, and but for the grace of God, that could be me.
Right. So well, you always had a certain sensitivity and awareness about you, and we know that's a gift. And I appreciate the fact that you were introduced and mentored and supported by someone who I call a messenger of hope. That's how you described him. And he gave you some information and validated who you are, that you also are a messenger of hope and recovery. Specifically, though, today we're talking about opiate crisis and substance use disorders and just the overarching need for services to be available to those who suffer from addiction. You've been working in this arena now for 25 plus years, consistently, no breaks. I know you, and I'm talking about extended days, and you sometimes work with multiple agencies. Why such a commitment to substance users? Where did that come from?
My dad was alcoholic, and he died when I was 12, and that cut me to the core. And I didn't know it during that time period, but it impacted me in such a way that I was going through life feeling like I ain't need nobody. I wasn't gonna let nobody get close to me.
Right.
And in a lot of ways, a lot of my guidance came from the streets.
Right.
So I'm not a dumb guy. I left Gonzaga, I ended up at Howard University. And I eventually got a job working in the music industry. I was working at CBS Records. I was promoting for people like Teddy Pendergrass, the OJs, the Isley Brothers.
Yeah.
I was 22 years old.
Wow.
And I didn't have the foundation, right, for that life.
Right.
So things started coming at me.
And what did that life look like? What was that? What were you exposed to at such a young age?
You're 22 years old, you're riding around with limousines, you're riding around with entertainers. Back then I was selling drugs 100 miles an hour.
Right.
And that's nothing to be proud of, but during that time period, it was a means to an end. Okay. I got money. My boss, my supervisor, turned me on to heroin. So I started, up to that point, things were kind of fun, right? The first time I used heroin, I'll never forget it. It was like a light went off. And I knew that I would keep that feeling. I wanted that feeling integrated in my life. Like it was better than anything I've ever done before. And my problem isn't, the drug. My problem is the price that you pay to use the drug.
That's right.
The drug is just an inanimate object, but we will sacrifice everything. And, I went through that path. Okay. So once I started using and lost control, lost the house, lost the car, lost the job, lost the money.
That's right.
And, lost my self-respect.
That's right.
When I started losing my dignity and I started looking at the relationships I was having. I don't wish, to live without hope, to be in, emotional pain, much less physical pain.
So at some point you became hopeless, I imagine, because all of the things that you had worked for were removed from you as a result of your use. And that would lead anyone into a period and a bout of despair and hopelessness
I was completely depressed and hopeless. And because of my drug use and drug activity, I ended up in DC Superior Court. I was facing 15 years and the judge told me to get clean or I was going to do every bit of that time.
Yeah.
And he sent me to a program called Second Genesis. The director of that program, I will never forget. Ed Flowers was one of the people that was responsible for opening up the first residential program in the district. Both him and Ron, there was always argument. Ron Clark was the founder of RAP Incorporated, and Ed opened up the DC facility for Second Genesis.
I knew them
basically
both
around the same year, around 1972. And Ed left an imprint on my life, that I will never forget. Being in a therapeutic community, which was that was a fancy name for the treatment program, but that treatment program was very well run. Although on the outside, a therapeutic community back then, this was old treatment. Like if you do something wrong, they put a sign around your neck.
But I remember.
I needed that kind of help. I needed to be directed. And for the first time in my life, I felt connected. I felt that my contributions to the community had meaning. When they have job functions in those kind of programs, and I was like the coordinator, the highest a resident could go. And I realized at some point that they were training me to be a staff member.
Okay.
And I ended up in treatment. I stayed in treatment 27 months.
Right.
You don't see that anymore.
Right, which was very common back then before managed care put some requirements on length of stay. The average residential stay was 2 years.
Absolutely.
Yeah.
And I believe in long-term treatment.
Me too.
You've got these jokers out here who using, they have 10, 20, 30-year histories of using opioids. They're not going to unlearn that in 2 days of detox and a 28-day program. That's part of it. The other part of it is from a social learning format. What I've found is that, African-American people, we as a people don't do well with cognitive approaches. We do better with social learning. So it's not, it isn't just do as I say, it's do as I do. So if you
Right.
work in this field, you have to be very, you have to be about your work. You got to be about the model. You have to walk, not just talk to talk.
It's obvious that you believe treatment works. Not
Oh,
only were you
absolutely.
the beneficiary of treatment, you've been the administrator and practitioner of treatment. So you've been on both sides and you've seen the value both personally and professionally that treatment offers. When I first started this work, I never forget the medical director at that time, and this was 30 years ago. There was this old psychiatry formula that one used to use, and this psychiatrist said for every day sick, it takes 2 days to recover. Now that might seem pretty exaggerated, and it's not literally 2 days equals 1 day of restoration. But what it speaks to is what you mentioned earlier, and that is we can't abbreviate treatment. Recovery is a process. It's a lifelong experience. And the first phase can't be shortened just because of this managed care requirement, because we know that first phase of treatment, inpatient detox, is so critical and lays that foundation for ongoing recovery. So it's obvious treatment. You've managed many programs as clinical director, CEO, COO, and you know a lot about opiate treatment. Tell us what's going on today. What do we need to know about the opiate crisis in Washington, D.C. specifically in 2021?
Growing up in Washington, D.C., I'm gonna have to say, my first exposure to opioids, I remember being, I think it was the 6th or 7th grade. And back then, they had different programs in the communities, Manpower, Pride. And there were, I remember being in 7th grade, a couple of dope fiends came to present. And I say dope fiends because these were people who was straight off the street.
Right.
They had gotten clean and they were recovering. But back then, that's just how we saw people. And the stigma associated with substance use, especially opioid use,
That's right.
is something we have to continue to work to change.
Okay.
But they were talking about why we shouldn't use drugs. And at that point, I didn't know what a drug was. I knew that as I went along and, drugs became a way of coping for me, like smoking weed, 15, 16 years old, lying about it, ducking, dodging. And I graduated to other things. I started, selling coke and eventually discovered heroin.
Right.
And opioids in this community have been here a long time. This is not a new crisis for this community.
Okay.
This community, when people talk about the opioid crisis, I think about in the 80s and 90s,
Oof.
When we had open air drug markets.
Absolutely. I can remember what 14th and W,
Oh my
7th
God.
and 7th and
I
T.
lived at 14th and W. You hear me?
It was a community within itself, wasn't it?
Oh my God. I can probably name 10 people who are making $30,000 a day.
Yes, right.
If you were doing hand to hand, you at least 700 daily in a matter of hours, and that's just making $5 on each packet, each drug packet that you sold.
But when I think about 14th and W and 7th and T Street, these were open air markets. I mean, it was just, you could see it. You could see transactions, and you saw people coming and going all night long. Are you telling me
Every day, all day.
that experience still occurs today? Is there open market here in DC now?
Yes, there are open markets. They're a little more hidden than they used to be. But don't get it twisted. There are areas where opioid use is frequent.
Okay.
And, the thing about it, an opioid addict, generally any hardcore addict, we think differently.
Mm-hmm.
We process differently.
Mm-hmm.
We react differently.
Mm-hmm.
You know, and a heroin user can cop heroin in any country, even if he don't speak the language. Just give him a few minutes. He's going to figure out where it's at and how to get it.
That's right.
And that's level of skill to survive. And this is what I realized, that if you can survive in the murder capital of the world, you can survive anywhere.
That's right.
And that experience of being addicted, and I didn't know how to stop using, and I tried. Went on a methadone program, shot dope to get off the methadone, went and used methadone again to get off the dope, and then eventually ended up in the program. And I didn't know that I could be clean. I didn't think it was possible. And, you know, when I started going to rooms of Narcotics Anonymous, I saw people who I thought were worse than me. And if they could get it, I knew I could get it.
Absolutely.
And
absolutely.
So for me, and then one day I raised my hand in a meeting and I shared honestly and openly, and people welcomed me with open arms. And they said, "We love you. Keep coming back.
It works if you work it."
Thanks for sharing.
That's
and once again, I felt connected. And so for me, it's important for me to carry a message of recovery and to do all I can do, because I know what it's like to live without hope.
You know, well, during my treatment years, I met some of the brightest, most gifted, most talented folks in recovery centers. And you're absolutely right. It takes some creativity to maintain an opiate habit for any length of time. And I guess that's why they say in the rooms that you have to transfer the same energy and skill that you used in your addiction over into your recovery. And
that's what I love about residential treatment, because residential treatment, that's what I really do.
Yeah.
And what's hurtful is I look at the DC community now and this opioid epidemic that has continued.
That's right.
And it's been brought to national attention, right, because of our outcomes.
That's right.
And in the district, you know, we're probably number 3 in terms of the amount of overdose deaths related to opioids in the country. And there's no reason for that. Most of those people who have died as a direct result are African-American, predominantly males, predominantly long histories of use. And there are a lot of things that are missing from our landscape. We don't have a detox in Southeast. Right. We don't have a detox east of the river. We don't have a long-term residential program anymore. Right. We closed the social model detox, and things were slowly removed from the landscape.
That's right.
You know, in the city. And, you know, we have to do better about replacing those things. We have to do better about bringing dignity to people who don't have any right now. You have to give those people an opportunity, because but for the grace of God, that could be any one of us.
That's right.
Yeah.
You know, and absolutely, you know, one thing I realized is back in the 80s when we were providing treatment services, it was for the parents of the youth that we're now treating today. You know, I asked you to try to give me some comparisons of the opiate crisis back in the 80s versus now. And the two things that come to mind for me, at least, one is you find more persons snorting heroin today because of the purity and the availability of it. But there's another substance that's kind of joined in the party, and that's fentanyl, right?
Absolutely. Fentanyl and carfentanil.
That's right. Can you tell the audience a little bit how that gets introduced into this whole opioid crisis?
Well, think of it this way. The opioid crisis was brought about a number of different ways. One, the drug manufacturers that produce pharmaceutical drugs, they were offering incentives to doctors who would prescribe and eventually overprescribe. And as a direct result, created a crisis. You know, people started using OxyContin and oxycodone because it was quality control.
That's right.
Now, as far as the drug industry, and what I'm really talking about is the illegal drug industry. Anybody who gets a package or who gets their supply, markets that supply, right? That is a business that they basically run.
Sure.
And the profit margin in that business is crazy.
Right.
So, you know, in the 80s and 90s, you had a lot of people making money. Then the drug manufacturers, they're the ones who started putting the prescription drugs out there, which changed the landscape for the whole country.
Absolutely.
In the district, anybody, well, no, not just in the district, as a business, if I can put a better product out, right? If I can take this same package of heroin that I've been making and then cut it with fentanyl or carfentanil and make it more potent, the chances are I'm going to sell more product and make more money. Right. And in that regard, these guys that put these drugs on our streets, they, as a rule, stay a step ahead of the industry because their incentive is to make money. The incentive for interdiction, the incentive for stopping the traffic isn't as great.
That's right.
We're catching up, but we're never ahead of the game. And we got to get ahead of the game if we ever really going to make a dent in this, the opioid epidemic.
Yeah, absolutely. What impact has COVID-19 had concerning the crisis and access to treatment? And the backdrop right now is this pandemic. And how is that influencing the crisis at this time?
You know, Paul, quite honestly, you know, I do outreach, and me and some of the staff at Prestige Community Resources. Prestige Community Resources has been a great place to work. That's the nonprofit I'm a president of. And the reality is it provides a platform to reach out to people to plant seeds of hope. But, you know, you asked that question, and I remember going to Noodle Park on Division Avenue. It's called Marvin Gaye Park, but the people that use it, when I grew up, it was Noodle Park. And I went over there and somebody had overdosed. And the person that was injecting them with the drugs was right there. And, you know, I had flashbacks about how people are impacted and how they're living. And what can I do to help this person?
Yeah.
You know, we administered the Narcan. You know, the reality is the landscape, you know, the open air drug market, they're still there. Yeah. They're just a little more undercover. And the need for people to use drugs, when you look at some of the healthcare disparities, when you look at the lack of job opportunities for African-American men, you know, these guys are walking around, you know, not aware of everything that's at stake. And, you know, what's at stake is our future, our communities, how we live. And we all need to do our part to restore equity and, you know, to create equity and justice for everybody.
Absolutely. You mentioned Narcan. What is Narcan and how does it work?
Narcan is a drug that reverses overdose for opioids. It is a antagonist, which basically means it fills the opioid receptor and doesn't allow the opioid that you use to have access to the receptor, so you can't get high.
How is it administered?
It's mostly, it can be administered, it's mostly administered through a nasal spray. Okay. And that's the most common form used in the city. If you're in an emergency room, they may inject you with the Narcan, they may do it through an IV, but the reality is on the streets and in the communities, most people are using the nasal spray that Department of Health gives out. And there are a lot of different places you can get it. Prestige Community Resources, we're located at 1418 Good Hope Road. We give it out to the community all the time.
So in order to administer, does the person have to be licensed, have to have a medical degree? What are the qualifications for someone to provide Narcan to someone who's in an overdose state?
In the district, people who are certified to administer have to be certified by the Department of Health.
Okay.
Once you're certified by the Department of Health, it is absolutely okay to go out in the community, right, and distribute the Narcan or administer. But the other thing that you're doing is you're training addicts who are actively using to keep the Narcan close. You're training people who have users in their family, right, to keep the Narcan around. If you walk up on a loved one who's overdosed, you know, you have the means to save their life if that Narcan is nearby.
Yes.
If it isn't, then you may be in a situation where that person could die, or that you're completely overwhelmed and don't know what to do. So it's important for us as people who are certified by the Department of Health to go out and train others, and so, you know, we go into communities now, especially where there's basically an open air market, and they keep Narcan where they're using it. Now, I was in Marvin Gaye Park, and a guy walked me over to a milk crate that they were keeping Narcan in for anybody who overdoses that day, or, you know, they make it available to each other. And there's nothing wrong with that. You know, it is absolutely important because we can't depend on the DC police and the ambulance. They're overwhelmed, you know, and as good citizens, as good people, as good brothers, we need to help each other.
Yeah.
We need to do that.
For time's sake, I want to spend the last couple of minutes just talking about harm reduction. You know, we've talked about treatment, inpatient, outpatient. You know, what exactly is this model or philosophy called harm reduction? What is that?
Harm reduction is an approach toward treating addiction, where you recognize that the person is not ready to stop using. You know, so you employ strategies so they can use more safely.
Yeah.
A harm reduction strategy could be administering Narcan. But harm reduction for a whole slew of behaviors, like HIV, AIDS. One harm reduction strategy is to pass out condoms. COVID, harm reduction strategy is to pass out masks. You know, some of the people living in the community don't have income. They can't afford to go to the corner store and buy a mask, because that $2 that they're spending for that mask, they may need for, you know, food. They may need it for, you know, to get to the doctor's office. They may need it for something else. So we need more resources in the community.
That's right.
You know, where most people are living below the poverty line.
Yes.
That's not okay.
You know, I recently had an opportunity to visit a consumer who was living on the street. I believe it's 17th and Corcoran Street, Northwest, 17th and P. And if you've ever been down that street, there's a Safeway where some of the homeless guys have tents that's right on the sidewalk. It's just like two or three blocks of folks living in tents. And I went to visit one of our consumers. And of course, he introduced me to everyone on the roll. And one of the chief requests they had was, we need masks. We don't have money or access to the masks. And you know, they're at great risk. They're out in the community. They're in close settings with one another. You know, there might be 15 people living on one block, and they're all in ill health. Some of them are actively using substances, high risk. So you're absolutely right. I appreciate this harm reduction model. Now, some folks, I'm sure we have opponents. We have people on the other side that said certain people don't deserve these intervention types. But the compassion and sensitivity that I believe we should offer our humankind is critical. And actually, sometimes is the only gateway to invite someone into sobriety. The compassionate greeter is the door that I'll probably walk into once I make a decision to stop using.
And getting to the point where you can actually make that decision.
That's right.
You know, Paul, I remember hustling, and I used to call myself a soldier.
Yeah.
A true soldier.
Look at that.
I stand out on that corner, sell drugs 24/7.
That's right.
You know, and the drugs be hitting and holding. And I thought about it one day, and I said, you know, well, what is a soldier? A soldier is a person who takes an oath, usually to their country, you know, and they're willing to put their life on the line for their belief in country. So I use that definition and applied it to myself. Am I saying that I'm willing to lay my life down for drugs? And for me, it was a wake-up call. It was a spiritual awakening where I had to make a decision about what I stand for and who I wanted to be. And my mother didn't raise a drug addict.
No.
You know, that's something I chose to do. And I had to make a decision. I don't want to do that no more. And thank God that there were resources in the community that helped me. And, you know, for the life of, you know, I used to ask, well, why me? Why did I get help and other people didn't? And it's not for me to question God's will.
No, it's not.
But it's for me to do God's work.
That's right.
So if I've been restored as a direct result of grace, then it's important for me to pass the blessing on to someone else. Because if I don't, God can take that blessing away.
You talked about making a decision. And, you know, they tell me in recovery that treatment doesn't begin until you make a decision to stop. And you were able to make a decision, and you and us, the community at large, were beneficiaries of you making that decision. I remember on occasion, this date at C. Sosa, where we both worked. We both, you and I, worked at the Reentry and Sanction Center. I went up on the unit, and I was greeted by this young man. He must have been 22 years old. Matter of fact, I didn't greet him. He walked by me on the unit. And I was so moved by his presentation because he had tattoos from all over his body. Matter of fact, there was no space on his face that wasn't marked. And it went all the way down his neck, I mean, his entire body. And I had to stop him. I actually stopped and said, come here, young man, how you doing, man? And I had to acknowledge the fact that he made a commitment to live in the streets. He made a decision. He said, I'm going hard. And that's what he verbalized to me, that, you know what? I see this recovery stuff you're trying to offer me and a different way of life. But he looked me in my eyes and said, I'm committed to the life. Now, unfortunately, at some point later on, his commitment cost him his life. So he really was committed. But I respect the decision that has to be made for any individual to change their way of life and to improve the quality of their life. Hey, listen, I would be remiss if we didn't close by me just letting people know that you're also, I know you were executive in the music industry with CBS Records, and but many people may not know, or let me say this, many people do know that you are also a musician. And in fact, you put together a very successful band that we're just waiting to see perform on the regular once we get past this pandemic. So what's the name? You are a musician, is that correct?
Yes, I am a musician. I play drums and congas.
Yeah.
And the name of our band is Cruise Control.
Cruise Control.
And a lot of people in the band are in recovery.
Yes.
And, you know, this whole COVID pandemic for me had to help me make some decisions about the rest of my life.
Okay.
You know, Paul, we've known each other a long time, and I can't tell you how happy I am to be able to do a podcast with you.
Same here.
For the right reasons. Like, we want to help the community. We want to carry a message of hope. But the other part of it is, I need to celebrate my blessing in all areas of my life. So, my work speaks for itself. I put a lot of energy into helping people and helping the system and doing what I can, or at least doing my part, right? But, we also need to celebrate success in the things that we have passion for, with our families, with our hobbies like music.
Right.
And you'd be surprised at how those things will bleed into other areas of your life. Let's take fishing for an example. I love to fish. And I used to take my consumers fishing.
Okay.
And I remember walking up North Capitol Street one day, and this kid, he wasn't a kid, he was probably in his 30s, but to me, he's a kid. He walked up to me and said, "You remember me?" And in all honesty, I didn't. And I said to him, Second Genesis? And he said, "Yeah, you took me fishing." And nobody had ever taken me fishing before besides my grandfather. And he died when I was a child. I was 8 years old or so.
Right.
But you took me fishing, and that meant the world to me. And I will never forget you for that. When I run into guys like that, it's always about love.
Yes.
Because we plant seeds.
That's right.
We try to help. Music ain't no different. I love music.
Yeah, I've seen you perform. I've seen the band perform, and I see your passion and the synergy with the band members. And I just even noticed the music selections that you choose that are uplifting, positive, empowering. I paid attention to that, and I can't wait till this pandemic is behind us and we get a chance to see you and the group perform live several days a week, sometimes on the weekend.
We're gonna kill it. We're gonna kill it,
Right.
my brother.
The other thing I recognize is I've actually been to one of your rehearsals, and I've done music for a while myself, and I noticed that no one at rehearsal is consuming alcohol or using drugs.
No, we ain't doing that.
I haven't seen that too much. I've been to a lot of band practices, and you don't see that commonly. So your commitment. And what you said, you model a behavior, you live a lifestyle that supports messages that you give others about living clean and sober. Listen, Will, give us some hope. What can we look forward to moving forward in 2021 as relates to behavioral health services? Can we be optimistic this year that something will change? And what are your thoughts?
Well, in terms of behavioral health services, when I say, I want to do my part, as president of Prestige Community Resources, we do a food drive weekly.
That's right.
We feed about 300 people every week.
Man.
We do a phone drive. We give phones to the homeless,
Sure.
that are connected to our programs to ensure that they have access to healthcare, that they can talk to a therapist, community support worker, use the phone to call the hospital if you're sick, whatever. They have to have that. We have a few grants that we're currently doing. We have a housing program that provides transitional housing and stabilization for people coming out of the hospital or out of, detox or out of PIW. One of our grants is a peer certification grant where we help people become certified. And that's a national certification where you can have reciprocity in both Maryland and Virginia. Currently, that doesn't exist, but it allows people to get in the workforce and hopefully have a pathway to a middle class. My first job clean, I was making $16,000 a year.
Right.
And, when I look back on that was some of the happiest days of my life because I was learning, I was growing, and I was transitioning into the person I eventually became. We have a harm reduction grant where we actually go out and do harm reduction, and we train our staff in how to engage and how to develop cultural responsiveness. People talk about cultural competence. People talk about knowing how to engage, but you have to be responsive because if you're not responsive, you're going to lose your clients anyway. I don't care how good you are.
That's right.
You have to respond to what their needs are, because those needs are what drives their behavior. And if you don't respond to them, their behavior ain't going to change.
It's not.
No. One of the things I've discovered, in this journey is that anybody can be a counselor, but not everyone can affect change. And I want to be an agent of change. And of course, we all want the certifications and the licensures and all that. But when it's all said and done, you have to ask yourself, well, what's your legacy? Legacy ain't about how much money you made. It ain't about who you know. It ain't about how many houses you bought or how many women or men that you've gotten in your life. It's about the messages that you pass on to your community.
And
it's about living in God's favor and sticking close to your beliefs and passing those messages on to the people that you love, your family, children, friends, community. It's about being what you say you are, right? Not living, talking clean and living dirty.
Right, that dual identity.
We ain't doing that.
That's right. I, like you, have had the privilege and access to any sector of the community and any side of the city. And the best payday for me is when a consumer comes up to you. Sometimes you do recognize them, sometimes you don't, and thanks you for the impact you had in their recovery. That's a good day. When I have those moments and those contacts, I might just be walking down the street. Hey, Wells, what's going on? Hey, Wells, man, I just want to thank you, man. And I, like you, sometimes I'm kind of foggy on my recall. Like, we used to work on so-and-so. And so we're committed beyond the professional identity that we have to assume. We have to do the training and stuff. But I
got to do the work. Mm-hmm.
Got to do the work, but it's way beyond that. Mr. Bonnette, this has been great. I know when folks hear this podcast, they're immediately going to want to reach out to you. What is the best platform to make contact directly with you?
Well, first of all, I left something out that I wanted to say. And, one of the other things that Prestige does is we have a media grant, and which makes this podcast possible.
That's right.
But we're doing a documentary, we're doing public service announcements, we're using social media to push out this information to the community so we can touch more lives. As the president of Prestige, you can always reach me at our DC office at 202-796-5000. Mm-hmm. Okay. Website is prestigecommunityresources.org.
That's right.
You'll find information for our housing program, for our peer certification program, and from some of the other services that we provide there.
Okay.
Prestige Community Resources, as a nonprofit, we are always looking for volunteers. We're always looking for donations to help make the work that we do. We want to make it go further. We want to reach more people. We want to grow. I truly believe God didn't bring me this far to let me go. So in my faith, I'm going to have to do what's necessary, right, to move forward.
That's
and
right.
Moving this organization forward was been beautiful, is working with people like you and the rest of the staff there who, we share mutuality of purpose.
Right.
We all have a passion for helping the community. Some of us have a little more experiences than others, but we deserve better. Our communities deserve better. Our children deserve better. And if anything, this opioid epidemic and the COVID pandemic has taught me that life is so precious. You cannot allow opportunities to get by, because when you let them get by, you become stagnated. And I ain't trying to be stagnated.
There's too much work still. There's too much work still yet to be done.
Yeah.
We have to maintain our stamina and our commitment and our focus to the urgency that's always at hand. Mr. Bonnette, this has been great. you're representing Prestige Community Resources in rare fashion. I'm sure we are glad that you are present of the community resources Prestige. You're doing great work. And I salute you for your legacy and for your efforts in the community. Listen, Cruise Control Band, I want everyone to kind of be on the lookout for the schedule. They'll be, I'm sure, released very, very soon. Looking hopefully in the summer, you'll be able to perform again live at the various venues. Hey, family, this has been great, Mr. Bonnette. We appreciate having you. Thank you for your time. And for our audience, if you want more information about who we are and what we do here at Prestige, please visit our website at prestigecommunityresources.org. Thank you so much for joining this episode with us today. It has been a pleasure. Until next time, stay safe, stay well.